Welcome to part 6 of our trans-inclusive healthcare series. Thank you so much for tuning in, and if you haven't already, be sure to check out the other videos in this series. In this episode, we're going to share some essentials about how therapists can provide affirming, competent care for transgender and non-binary clients. If you're a mental health provider, student, or just someone who wants to understand this better, please continue watching. Today, you'll hear about intakes, discussing identity, when identity is or isn't central, treatment planning and goals, adapting your practice, power dynamics, and the inclusion of sociopolitical context. Intake. Let's start here. One of the most powerful things therapists can do early on is create a space to talk about identity, not just gender identity, but also how a client experiences minority stress, resilience, and coping. These are all key to understanding a person's mental health in context. Ask about experiences with gender affirmation, gender dysphoria, and how these intersect with their broader life. Research shows that exploring minority stress in therapy can support well-being for trans and non-binary clients. Discussing identity, when identity is or isn't central. Here's where nuance is important. While for some clients, gender identity is central to their current concerns, for others, it is not. As clinicians, it's important to follow the client's lead, incorporate identity meaningfully, but do not overfocus on it in ways that feel marginalizing or irrelevant. Consider the following scenarios. A transmasculine client, Tim, comes to therapy reporting increased anxiety and depression after starting a new job where coworkers frequently misgender him, and his employer has no policy supporting name or pronoun use. A non-binary client, Clive, starts therapy to process grief after losing a close family member. They briefly mention their gender identity in the intake, but do not bring it up again in sessions focused on their loss and family relationships. These scenarios both involve a trans or non-binary client. However, it's important to consider the centrality of identity with the client's presenting concerns. In the case of Tim, his case suggests that the lack of support in his workplace around his gender is central to his concerns of anxiety and depression. For Clive, their grief may be tangentially related to their gender identity, but they are not presenting it as a primary concern. If you are unsure if the areas your client is coming in to work on are related to their gender experiences in some way, you may consider directly asking this. You might consider saying something like, sometimes people's gender experiences can play a role in how they are treated by others, how they experience the world and society, or their overall well-being. How do your gender experiences relate to the experiences you're hoping to address in therapy? This gives the client the opportunity to inform you of their perceptions of their situation and gives them some agency to discuss if this is important to them. For someone like Clive, who is coming in to address experiences of grief, it could be that they say that their gender is unrelated to that, and in that case, the therapist should follow their lead. An open-ended question like this might allow them to share other information, though, that could be very helpful in understanding this grief. For example, they may not have been able to come out to their family member prior to their passing and feel a sense of grief about this. Or maybe they feel impacted by their gender roles and how others view the expression of grief in relation to their gender experiences. Ultimately, asking an open-ended question allows you to understand the client's experiences and honor what they share rather than making assumptions that may be inaccurate or pushing a narrative that does not align with their experiences. Treatment planning and goals. Related, developing treatment plans might be an area in which you should consider the centrality of identity. Let's take the examples of Tim and Clive again. For Tim, his anxiety and depression have increased since experiencing misgendering at work. Here are some treatment goals you might consider when working with a client like Tim. Discussing the impact of misgendering in workplace policies. Exploring coping strategies for minority stress. Validating feelings of dysphoria and discussing affirming supports. Now let's think about Clive, the non-binary person experiencing grief after losing a family member. Let's imagine that Clive has shared that their experiences of gender are not impacting their grief, Thus, it would not be appropriate to center their non-binary identity in their therapy goals. Instead, you would consider centering the client's stated goal of coping with grief and loss. Continue to maintain an affirming space and stance, such as using correct pronouns without making gender identity the focus unless the client initiates that discussion. Hyper-focusing on someone's trans or non-binary identity can be just as invalidating as ignoring their identity entirely. It's important to strike a balance and, again, following what the client expresses and needs. Adapting your practice. Additionally, it is important to adapt your approaches to therapy when working with trans and non-binary clients. The best therapies are flexible and affirming, and it is recommended that you review treatment guidelines and adjust evidence-based practices to better meet the needs of trans and non-binary clients. It could be as simple as updating your language, or as involved as reworking treatment goals to align with what affirmation and resilience looks like for that person. For a more thorough review of steps to adapt treatment to be more affirming, see our video description below for resources, books, and articles that can help you improve your practice. Power dynamics. Therapy can replicate problematic power dynamics if we're not careful. Therapists often act as gatekeepers to accessing medical care for trans and non-binary communities and have power within the therapeutic relationship. Therapists should be attentive to how they share power with clients and take efforts to promote autonomy and empowerment for clients. Here's one way to work on shifting the power dynamics. Share your clinical understanding of the client's presenting concerns with the client directly. Ask them for their feedback. Let them weigh in on the conceptualization of their struggles. This not only affirms their identity, it honors their expertise in their own life. For example, if we think about working with Tim, the trans-masculine client with depression and anxiety related to workplace discrimination, you might say, I've been thinking about how everything we've talked about connects, and I'd like to share how I'm understanding things so far, just to see if this feels accurate or if there's anything you'd add or change. It seems like a part of what's contributing to the depression and anxiety is the way you're constantly navigating a world that feels unsafe or invalidating as a trans-masculine person. You've also talked about feeling isolated and tired of having to educate people or advocate for yourself all the time. I think the ongoing stress of all of that might be wearing on your energy and sense of self-worth. But I want to check. Does this way of putting things together feel right to you? Am I missing anything? I really want to make sure this reflects how you experience things. This gives Tim the power to understand where you are coming from and challenge aspects of your understanding that might not fit with Tim's perceptions. Either way, you leave that conversation with better insight and having validated your client's experiences, giving them the influence over your understanding of their life and how therapy will progress. Inclusion of sociopolitical context. Next, take a moment to think about the world your client lives in. The sociopolitical climate, laws, policy, and media narratives deeply affect trans and non-binary people's safety, access to care, and mental health. Being informed about local laws and national trends helps you better understand the daily stressors your client may face. Research shows that hostile sociopolitical environments can directly impact mental and physical health. So being competent in working with trans and non-binary communities also means being context-informed. It helps to check in with clients about how they are doing in the wake of attacks on trans and non-binary communities and to make space for discussing how the sociopolitical context might be influencing their mental health and well-being. In closing, caring for trans and non-binary people in therapy isn't about having all the answers. It's about being open, curious, and affirming, and willing to grow. Creating space for trans and non-binary clients to feel seen, supported, and empowered can be transformative. What we have shared today here is just a starting point. These are a few of many important steps toward affirming care for trans and non-binary clients. True competency requires ongoing, dedicated work, self-reflection, and continued training. We encourage you to seek out further education and resources to deepen your practice and support your work when working with trans and non-binary clients. Thanks for watching. If you found this helpful, like and subscribe and check out the other videos in this series for more content on inclusive healthcare. And check out our description below for other resources, books, articles, and materials that may help improve your therapy services when working with trans and non-binary clients.